Good day, guys. I'll be talking about upper respiratory tract infections. I'll be talking about their cause, symptoms, management. Upper respiratory tract infections are quite common in children compared to, say, adults. So a child can have up to 4 to 6 upper respiratory tract infections in a year. An adult, maybe 2 in a year. The causes are commonly viruses, and these include things like the rhinovirus, respiratory syncytial virus, influenza, adenovirus. These are some of the common viruses. Less commonly, we got bacteria, for example, such as in streptococcal pharyngitis. The viruses, what they do is they home in or have a tropism for the mucosa of the nose, and from infecting the mucosa of the nose, they can spread to other structures, including the pharynx, affecting the adenoids, the ears, the sinuses, and of course go into the lower respiratory tract as well. And from this, we can see that complications of upper respiratory tract infections include sinusitis, otitis media affecting the ear, and lower respiratory tract infections. Presentation or the symptoms of respiratory tract infections include nasal congestion, developing a runny nose, sore throat, fever, and so on. Normally, the symptoms will from the day infection sort of increase in severity until about day 3, where so they peak at day 3, and up to day 10, we should see a reduction in their severity, but they can last up to 2 or 3 weeks. So that's sort of the natural history, if you like, of upper respiratory tract infections in terms of the symptom severity. So in managing the patient, the most important thing is going to be reassurance. So patient and parent education will play a great role in reassuring, in reassurance. So what might you educate the patient or the parent? You may educate them about the cause of the infection. That largely these are viruses, and in what we might say normal patients with no pre-existing comorbidities, for example, like asthma or other immunocompromised states, there is no need to employ any antibiotics. So that could be just a reassurance in that way. But largely, interventions are going to be for improving the comfort of the patient. So when it comes to fever, paracetamol will be quite effective, and this is going to be, the dose is going to be based on the weight of the patient. Ibuprofen is somewhat more effective than paracetamol when it comes to improving comfort in the setting of fever. Some people alternate the two medications to treat fever. Other things are using vapor rubs, throat lozenges to improve the sore throat or improve the comfort when it comes to sore throat. Honey may be used as well, and it's recommended for patients over the age of 1. This is tried to avoid infection with botulism in young people less than 1 year old. And then you can sort of talk about safety netting in this context. So what might constitute safety netting is, as we said, normally the symptoms will peak at about day 3. So any symptoms becoming more severe beyond day 3, say beyond day 5, say day 5, then that patient needs to be reassessed again. Any development of shortness of breath or respiratory distress, difficulty swallowing, drooling, and so on, these will be indications that the patient needs to be returned for reassessment or reevaluation, and that perhaps more aggressive measures should be taken to treat that patient. So that is it in short on upper respiratory tract infections. Perhaps in a future video we can talk about sort of the pathogenesis of these upper respiratory tract infections, how the viruses interplay with the mucosa and so forth. And we can talk about specific complications, whether it's sinusitis or otitis media, lower respiratory tract infections, and how to manage them as well. But this is it for now. Thanks for watching.